This is the shoulder of a 26-year-old male who sustained multiple dislocations of his shoulder. This is the left shoulder in the lateral decubitus position. This is freeing of the Bankart lesion, which is the labrum attached to the inferior glenohumeral ligament. There's been some amputation of the labrum, and the labrum is being completely freed from the medial aspect of the glenoid neck, as it is essentially an ALPSA lesion. This is lightly decorticating the medial glenoid neck for later reattachment of the Bankart lesion. You can see here shifting of the tissue, the labrum and the inferior glenohumeral ligament being shifted superior and medial. This is a suture lasso inserted in the inferior glenohumeral ligament and labrum, passing a nitinol wire to then shuttle a fiber wire suture. Here a drill guide is placed on the face of the glenoid, slightly superior and medial, followed by drilling for placement of an Arthrex bio-pushlock anchor. This is the anchor with a number 2 fiber wire suture being placed. These sutures are tensioned and the inferior glenohumeral ligament is shifted superior and medial, as can be seen here. And the anchor is then impacted into place. These sutures are then cut, and the process will be repeated. The suture lasso is then placed in the superior aspect of the inferior glenohumeral ligament, progressing towards the middle glenohumeral ligament. The nitinol wire is passed and the suture is shuttled, drilled, and the anchor is then impacted into place and cut. Another anchor is placed superiorly for a total of 3 anchors, creating adequate shift of the tissues and stabilization of the joint.